The Virtual Curbside is a production of the Utah chapter of the American Academy of Pediatrics, the Utah AAP, working together to improve children's lives through education, advocacy, and networking. Hi, this is Paul Wirkus from the Utah AAP. Welcome to this week's edition of the Virtual Curbside, where we bring pediatric providers together with subspecialists to get smarter about all things pediatric and better acquainted as a community of caregivers. The Virtual Curbside is brought to you in part by a generous grant from Primary Children's Hospital. Primary Children's Hospital, the child first and always. Welcome back to the Virtual Curbside. This month, in conjunction partly with National Poison Prevention Week, we have the great privilege of being able to talk with Dr. Mike Moss, who is the medical director of the Utah Poison Control Center, about childhood poisoning. Mike, welcome to the podcast.
Thanks for having me, Paul.
Now, you not only are the director of the Utah Poison Control Center, you have academic appointments in like 12 different departments at the U.
Yeah, I wear a lot of hats at the university.
But you know, at this altitude, especially during the summer, wearing a hat is just good practice. So you're boarded in emergency medicine, medical toxicology, and addiction medicine.
Yep, all three.
You are a busy guy. And so you went to medical school at The Ohio State University. Is that right?
The Ohio State, correct?
Just an Ohio State University, but we went to The Ohio State University and then off to Virginia Commonwealth to do your residency and chief residency, and then over to the other ocean to Oregon to do medical toxicology.
Yep, that's right. Back over towards the west. I grew up in California and Idaho, so coming to Oregon and then Utah is a little closer to home.
So you're a well-traveled guy.
Yeah, all over the place. Finally in one spot now.
That's a good thing. How long have you been at the Poison Control Center here?
So this is going to make 8 years. It's going to be just about 8 years here I've been in Utah.
Terrific. Well, let's dive right in. Do you have any disclosures that you need to share with us?
No, nothing to disclose.
All right, let's jump in. So why are kids particularly vulnerable to poisoning?
Yeah, certainly a couple things that make them more vulnerable. One, at least when I'm thinking from a poison center standpoint, they're more likely to get into things the rest of us wouldn't, right? They don't read labels. They can't tell the difference between a medication and a candy. They will find things on the ground, put things in their mouth that of any sort of thing, right? And then, of course, we just have the size difference that some amount or dose that would be trivial or nothing in adult or subtherapeutic could be toxic just based on pure weight alone. And then we also bring into some other things like decreased metabolism in certain age groups too, especially with our infants, where they may not get rid of those medications as much. And maybe they're more sensitive to these drugs than an adult would be.
So what exposures do you deal with most commonly?
We've got some pretty common things that we deal with over and over again. And all of these can be explained by, what's available at home. So this is cosmetics and cleaners, right? What's out on the bathroom counter gets dropped on the floor. What are you leaving around the kitchen of the house where the kids are? For medications, these are things that everyone's taking all the time. Even if you don't have health problems, you've got young parents and young kids, right? There are analgesics, ibuprofen, acetaminophen, these sorts of things are around. And then things like diaper cream that are very unique to having a kid there, stuff like that. Everything that's just around the house within arm's reach of a child, that's what we get called about multiple times a day.
What's particularly dangerous about cosmetics?
Fortunately, most of the cosmetics are okay. They're just out there and they're easily accessed. So that's a good thing that if it's your lipstick or your chapstick or a lotion or something like that, that most of those are just fine and aren't going to cause problems. Of course, maybe the kid cries or the parent's surprised and sees the child is very worried and the kid's freaking out and everyone calls the poison center and say, hey, this is all okay. Rinse their mouth out. They're just going to be just fine. We'll call you back in a few hours to make sure nothing else is going on. So fortunately, most of those are quite common. Most of them are pretty benign and nothing to worry about.
Gotcha. So when my son got a dog, he was really careful about which houseplants had around the house. And I think his dog is a lot less impulsive than the average toddler. Are there plants I should worry about?
There are a couple different plants. Most of them are okay. The kid won't do much more than like chew on a leaf. And the nice thing about the toxic ones is their toxicity is they're pretty irritating to the mouth. And so the child will figure out pretty quickly that they don't like this. These are things like Dieffenbachia. Some of those, this is one that you've seen everywhere. Every sort of office plant, everyone's got one in their house, whether they recognize it or not. There's little calcium oxalate crystals in there that can just kind of mechanically stab in the mouth. And the good thing is these are okay. Be very uncommon for like significant swelling or airway involvement to occur. So Most children have a little bit of mouth irritation. They spit it out and then things are all right.
Gotcha. We'll talk more about this, I think, next week, but there are more recreational substances around probably than ever before, and they look more like things that kids would want to get into.
Yeah, now everything is a gummy, everything's some sort of treat for the adults and for the
Yeah.
kids. And they may not be stored like medications. They may not have a child resistant cap on them like prescription medications. They may not be kept up out of reach. They may be kept more with food products. And of course, the child can't read the label, and this thing looks like a gummy and tastes like a gummy and tastes good. Cannabis, THC edibles is probably our big one there, where this looks like candy and the kids eat it and then get a little bit too high.
Yeah, I would imagine. Well, so over the next couple of weeks, we'll talk more about some of this, but I wanted to start off just talking about how a poison control center works. Do you have regional coverage or is that set up?
Poison centers are regional. This is not a top-down, initiative. This is where we have ended up over the decades of how we have poison centers. Here in Utah, we're the second oldest poison center since the 50s that we've been around here in Utah. And we cover all of Utah and only Utah. Other states are a bit different. Bigger states, California, Texas, Florida, have a network of multiple centers that cover their states. And then some of these smaller rural states like Idaho and Montana, the Dakotas, Wyoming will contract with another poison center to help cover their states. So there are 53 poison centers now across the country, and all of the states and all the territories of the US are covered in one way or another by one of those poison centers.
How are they funded?
If you know the funding of one poison center, then you know the funding of one poison center.
Right.
So
Right.
in Utah, we are funded mostly by the state legislature, and we're within the University of Utah. So we are both academic and state funded, but not a state agency. And then we get a little bit of federal funding too, that particularly funds some of our outreach education efforts and some of our printed materials and translation and things like that. And other states are a bit different, that they may use some of the state Medicaid and CHIP funding, since so many of our calls are related to children. Some poison centers are standalone nonprofits, and they have to get money from whatever grant and source they can, or subscriptions from hospitals who want to be able to access their poison center. So a whole mix of funding. There's a small amount of federal funding available to all the poison centers, and then a mix of either academic or state funding on average that takes care of the rest.
Do poison control centers tend to collaborate with each other in any way?
Yeah, we do. So we all work together. I'm about to go to one of our national poison center business meetings here in a week or two, where we'll all talk about some ongoing issues. We have a national organization called America's Poison Centers, and it's an accrediting body for all of our centers. And on top of that, all of the data, all of the calls that we get go into a big national database in near real time. And so we have millions and millions of calls in there that help us study new substances that might come out and track trends in poisoning exposures across the country. So we all work together. And if we get a call from one state and the person ends up getting transferred to a hospital in a different state, we'll call that other poison center so they can keep tabs on what's going on.
Oh, that's fascinating. Now, if I'm in Arizona and need to call a poison control center, will it feel a lot different than if I call a poison control center in Utah? Does the interface tend to work similarly?
Yeah, it's going to be a pretty similar experience. Some centers are staffed a little bit differently. Some may have more pharmacists, some may have more nurses, some may have a mix, but you're going to have the same sort of thing. They all get the same training, and there is a certification that's special for our, we call them specialists in poison information, that whether they're nurses or pharmacists or an occasional physician that's on the phones, they all have that certification. There'll be a medical toxicologist who serves as medical director of that poison center wherever you are. We all have our own sort of operating procedures and protocols and things like that, but you'll get a similar experience no matter who you call.
And his phone number is always the same?
Phone number is the same. There's been a 1-800 number for about the past 25 years or so, 1-800-222-1222. We'll make sure to repeat that over and over,
Yes.
and that will get you to your local poison center. We still do struggle a little bit with automatic routing of calls. So sometimes if you call from your cell phone that's from a different state, you might get pushed over to that other poison center. If you're calling from a landline at the hospital, for instance, then you'll be all right. But if you pick up your cell phone and you've got your old cell phone from another state, then you may find yourself routed to the wrong one. It's kind of unpredictable, and still trying to fix it after all these years, but we will get you to the right place one way or another. We will always happy to take calls from patients at home who end up calling the wrong center, because we'll just keep them at home. But if there's a sick kid that's in the hospital, then we'll want to make sure that poison center that's covering that state is the one that takes care of it.
Now, if I dial from a rotary dial phone, do I need to know the number from before 25 years ago?
No, I should get you all those information.
Good to know. That's huge, isn't it? Just the notion of having a number that you can call, it makes that a much more teachable process than it would be. A lot of this goes without saying, but let me just ask a couple of questions that I think allow you to state the obvious. So how does a poison control center help to keep people safe?
Well, we have kind of 3 parts to our mission, right? One is prevention, 2 is then management of people, and then also education and research. Part of our mission, similar to anyone who's academic. So number 1 would be prevention, right? That we ask our pediatricians, right, to be giving that anticipatory guidance to their young exploratory patients who are starting to move around and explore that environment, make sure people have the poison center number, teaching them some basic principles of, hey, you need to keep things locked up and away from the reach of children and not put things in the wrong containers. Make sure you dose things appropriately, things that we'll talk about more later. And then if someone does have an exposure, right, because kids are always going to get into something, we can never be 100% perfect in keeping everything out of their reach,
Right.
that we can tell you, is it safe to stay at home or is this something that needs some closer attention in a hospital or not? And that helps us by avoiding unnecessary visits, unnecessary time away from home, saves those working in pediatricians' offices and urgent cares and emergency departments from having people who are going to be completely fine. So we can keep you out of the hospital and keep you reassured about something that might be unfamiliar.
That's huge. It almost feels too good to be true in some ways, doesn't it?
Right.
And look, I don't think I know any pediatricians who haven't maybe called poison control at some point if we have kids at home. But what an amazing benefit that is, that we know we're going to get well vetted, educated information about this thing that a child or an adult has ingested.
Yeah, this resource is entirely unique. That 24/7, you have a trained healthcare professional that's going to answer the phone within moments to talk to you and talk to a real human immediately, not get a call back next day, wait on hold for half an hour. We will talk to you and you'll talk to someone who's got expertise within moments.
That's pretty amazing. You mentioned earlier that you collect data and you share data. I'm guessing that there's a fair amount of publication about this, both within centers as well as in collaboration with other researchers.
Yeah, so that database is fantastic. You can read all sorts of different studies where someone will say, here's a new drug on the market. And of course, there's no overdose data on it when it comes out. And it was studied in adults and never studied in kids. And then we'll collect all of that information over a few years and say, all right, here's these kids. They all got into 1 or 2 tablets and look, they were all totally fine. Or maybe you have something really serious and then we have to be really cautious when we hear that particular substance. The National Poison Data System, NPDS, they publish an annual report that looks at all these, big trends of what's happening and what are the most common exposures and tons of data that's in there. All of us at the poison centers can access this database. Any pediatrician who's interested in doing a study can easily collaborate with their local poison control center and pull data from that system. And we work with people on the federal level, FDA or CDC, to keep an eye on what's happening with trends in poisoning. We keep an eye on it at our local level to see what's different about Utah, for instance, compared to the rest of the country and anything that we need to be aware of in particular. So huge, enormous database, millions and millions of cases. That's one of the great benefits. And one of the reasons we want you to call is that it helps us keep tabs on things. One, of course, we want to take care of that patient and that child, but also that gives us more data to know what's going on.
One of the things that pediatric practitioners struggle with, I think, generally is the whole notion of dosage being a moving target. That since we dose by size and by body mass or by some proxy for body mass, we sort of have to know what fits in a particular area. And one of the challenges is that frequently those studies have not been done. The average over-the-counter medication says under the age of 2, consult with your doctor. That's an even bigger issue for you, isn't it? Because we're dealing with effectiveness and a little bit with safety, but for you, it's safety, safety.
Yeah. So for so many of these things, we just don't know. It's always tough to estimate a dose in all of these scenarios too, right? The kid may or
Yes.
may not have had a tablet. They're found playing with a pill
Right.
bottle because it rattles and makes a fun noise. And some of them spilled and they
Right.
might have chewed on one of them and there's some stuff on their lip. Or did they eat 10? And that also challenges all of our studies too, of like, well, we don't actually know if the kid even got any to begin with, or did they just look at the tablet? And then did they get 1 or did they get 10 or whatever else? So these can be difficult when we pull all the data together from all these centers and we end up with hundreds or thousands of cases, then we can get a little bit closer to the truth of trying to figure out what's going on because, well, we don't have this information. We use some things of what's the highest dose in adults? Has this been studied in slightly older children and tolerated or not? What's the worst case scenario for something? And if we don't know, sometimes that's difficult for brand new things on the market that we end up having to send more kids into emergency departments for a little bit of monitoring. But usually for these new things, even within a few years, we've got enough information to help us. And then we're able to say, you know what, this is a brand new med, but now we've got some more information. We know this. Yep, it's in fact similar to other things in its class, and we're going to be okay. Your kid's going to be okay. We'll keep you at home.
Yeah, what an amazing service. Now, in terms of advising people about using a poison control center, so for one thing, they should know the phone number, 1-800-222-1222. And beyond that, what other information should we tell people to be prepared to have?
Well, we of course want to know what did someone get into, which sometimes isn't clear because things get transferred into a different container. We don't know. But when possible, having the bottle, a cleaner or chemical, or it's a prescription medication, anything that we could know about the patient too, right? And age and a weight and other medical problems they might have, medications they might be taking that could interact with the thing there. So you don't need to know a lot. You can go ahead and call us and we'll figure it out on the fly there. But of course, knowing the original container and what's actually in it is probably our biggest struggle because there's lots of things that have the same brand name and that brand may make 5 or 10 or 20 different products that are slightly different, whether that's a household cleaner or a prescription medication. How many different sorts of Tylenol or NyQuil or other brand things are out there, or Lysol brand cleaners? There's a million of them. So as much as we can have that original container, that really helps us get to the right answer more quickly.
Should people hesitate to call?
No, not at all. This is entirely free to you. This is confidential. It's fast. No one's going to get you in trouble because your kid got into something around the house, right? You're going to be okay. You're not going to bother us. Well, this is what we're here and what we're trained to do is to reassure you. No one should ever feel stupid or embarrassed, pediatrician or otherwise, right? I always hear from other healthcare professionals who say like, oh, I was so embarrassed I had to call, but I didn't learn about this stuff in school. All these things around the house, I knew about prescription medications and all these things around the house, or like the plant we were talking about. I don't know if this plant's poisonous or not. So anyone should feel free to call. Don't feel embarrassed. We're happy to help. Whatever situation you think is unique or embarrassing to you, I promise you, we already had 10 calls about that today.
And I'm sure that there may be times in the privacy of your own mind, you may shake your head, but it sounds like people shouldn't expect to get a stern lecture.
No, we're not going to get you in trouble. Of course, we'll say, hey, in the future, it's good to keep things, locked up in a way. But in the moment, we're here to help you.
Yeah, wonderful. Well, this has been very helpful. Really appreciate being able to talk about this and want to pursue this more over the next couple of weeks. Remember, this month is National Poison Prevention Week. That'll be the third episode we'll launch during that week. We really appreciate you taking the time to talk to us today. I appreciate you sharing your expertise. Anything else we ought to talk about this week, do you think?
No, I think that's good.
Great. Perfect. Well, for those of you who have questions, please send your questions to questions@vcurb.com and we'll deal with those in a couple of weeks. In the meantime, make sure and like and subscribe and all those things that keep podcasts alive. And we'll talk to you next week. Thanks for joining us. Thanks for joining us. We look forward to getting together again next time. The virtual curbside is available on iTunes or wherever you find your other favorite podcasts. Be sure to like us and subscribe. We want you to like us both because we're needy that way and because that will help other listeners like you find us. Check out our website, vcurb.com, for supporting materials, schedules, and other great stuff. The Virtual Curbside is an educational production of the Utah chapter of the American Academy of Pediatrics. The opinions expressed in this podcast, while carefully considered, are ultimately the opinions of the presenters and not necessarily of the American Academy of Pediatrics or our employers. And remember, the content of this podcast shouldn't be seen as a substitute for seeking actual personal medical care. If this is an emergency, hang up and dial 911. Otherwise, schedule a visit with a caring healthcare provider to try to get to the bottom of your concerns. None of this could happen without Elisa Stoddard, our extraordinary executive director of the Utah AAP. Many thanks to Tim Cosgrove for his help on the website and logo design. Thanks to Phil Wirkus, who composed the theme music. See you next time.